often surprised by how little information women are given when they do go on the birth control pill. I refer to this as kind of a lack of informed consent, because women don't really have an understanding of the mechanism of action often and what's happening in their body. If you are on the combined oral contraceptives, this combination of hormones shuts down the reproductive system. It essentially works on the brain and it shuts down the production of your own hormones. So we are not cycling, we are not ovulating. And this is a really big deal for the body. We do know that with the combined oral contraceptive, this can actually worsen insulin resistance and inflammation, as evidenced by, inflammatory markers like our high sensitivity C-reactive protein. And we also know that two kind of root causes or drivers of PCOS are blood sugar and insulin issues and chronic low-grade inflammation. And here we are using the oral contraceptive as the first line of intervention for treatment for PCOS.
Well, thank you so much for joining me, Jillian. This is such a pleasure to have you. And we were meant to chat last week, but it was a bank holiday, so we had to rearrange. So I'm so glad that we actually get to chat right now, and it's really such a pleasure. So how are things over there with you at the moment? You said you're in South Carolina, right?
Yes, in South Carolina, it is hot, it is humid, but I am loving it. So things are great over here.
Lovely. So today I wanted to talk to you about a really important topic that women are dealing with today. It's very prevalent, it's really common, and that is PCOS. So I know that you're one of the best people to go to when it comes to your knowledge on PCOS. I know that you have a functional medicine practice. I know that you have a program designed purely for women struggling with PCOS. So you really do have the knowledge that the listeners need right now if they're struggling with PCOS. So that's what we're going to be talking about today. But really, I want to first of all kind of dive into, if people don't know who you are, to kind of dive into who you are and what your journey is. But first of all, what I wanted to say is what I love about your journey, because I've already kind of had a look through what you've been through in your time. And what I love about your journey is that you said that in the beginning you were typical kind of class A personality, like, lots of exercise, lots of stress, work, go. If you're resting, then, you shouldn't be. Yeah. So I think that is so relatable to women today. And that is a huge part of your story. So if you can dive into your story and how you came to where you are today.
Yeah, absolutely. And I'll try not to be, super long-winded here, but I do know a lot of women can definitely relate and kind of see themselves in my own journey. And I think as practitioners, a lot of us have had our own kind of personal health challenges and experiences that kind of brought us to that more holistic approach and, practicing functional medicine. So my own health journey started when I was in grad school, and I was a grad student getting my master's in nutrition. And at the same time, I was working full time in a really busy clinical nutrition research setting. And it was overall just a very kind of full time of life, busy schedule. And I was burning the candle at both ends, essentially. So working a lot in school, running half marathons, HIIT training, 5 days a week, sleeping very little, just, busy social life, all the things. And I started to experience symptoms, some symptoms that looked like anxiety, head hair loss. I was breaking out, I was bloated, and I really just didn't feel like myself. And this was very confusing for me as someone who, had an undergraduate degree in nutrition, felt like I was doing all the things. I was eating, predominantly a plant-based diet. Like, what the heck? Why are these things happening to me? And I remember so vividly seeking out support from my conventional providers at the time and, pushing to get some lab work done and basically being told, everything looks great. You're the picture of health. all looks good. Meanwhile, I'm starting to break out in eczema, flares, and all of these symptoms were just getting worse. So I'd go to, one provider and they'd say, oh, here's some, topicals for the eczema. Oh, do you want to try some, anxiety medication? And I always like to preface this by saying that, by no means am I anti-medication. And I think, medication can be a helpful tool for, people in certain cases. However, it was like one big game of whack-a-mole with my health is the way I like to describe it, where I was just offered, a pill for every symptom. And there was no investigation of the why, why were these symptoms happening? So I was really not willing to accept that these things were happening in my body for no reason. And it really motivated me to start to dive deeper into research on, female physiology specifically, and also to start to kind of investigate the hormonal contraceptive that I had been on for over a decade at the time and had never even really questioned. And, to my surprise, there was a decent amount of, literature out there about, gut disturbances, nutrient deficiencies, all sorts of things with the birth control. And I decided to take myself off the hormonal birth control. And in hindsight, I would have done things a little bit differently, but, kind of went cold turkey with this birth control and my symptoms went haywire. My cycle didn't come back. Everything got worse. And again, I was really just not getting support from providers in our conventional healthcare system. And I started kind of dipping my toes into the functional medicine world, seeking out more advanced training, and ultimately kind of hacking things together myself, getting deeper testing done, and really starting to heal my body from the inside out, changing my diet, peeling back on exercise, leaning into more rest, which was wildly challenging for me at the time. And it wasn't a short journey, but over time, I was able to actually eliminate and heal all of these symptoms that I'm mentioning using food, food and nutrition, lifestyle strategies, supplements. And, it was something that I had recognized was just not accessible to women. And in conversations with friends, family, clients, it just became really apparent that so many women were struggling with, similar things, and were just not getting the support that they need. So that was really kind of the first motivator for me to start to get deeper training and to ultimately provide women with the support that I wished I had had when I was struggling. And, I was struggling with multiple, I had multiple nutrition degrees. I was, training to be a dietitian then towards the end of my journey. And, I had the advantage of being able to do some of that. But I will be very honest that it was, my healing journey was much longer than it should have been, because I was really kind of hacking it together myself. So that was kind of the personal journey in a nutshell, and kind of what brought me to my deep interest and my deep passion in women's health specifically. And when it comes to kind of the PCOS component of things, one of my first jobs as an outpatient dietitian was at a big Boston hospital in an endocrinology department, where I started working with a lot of women with PCOS and saw a similar story where, women were coming to this clinic, they were struggling, their cycles were absent, they were rapidly gaining weight, they were experiencing skin issues, fatigue, anxiety, all the things, and they were offered one medication after the next to suppress symptoms. And many women just were not getting better. They were eating 1,200 calorie diets, just drilling their bodies into the ground, and everything was getting worse. And that was kind of my first exposure to working with women with PCOS, and identifying how significant, this problem with PCOS is in terms of the systemic effects on women's bodies, and how common PCOS is, yet no one's talking about it, right? So that's what really kind of, drove me to seek out more training in PCOS specifically. And when I started seeing really good results with the women I was working with, kind of outside of my clinical outpatient job at the time, I was like, man, I need to get out of this system, and I need to start my own practice and support women the way that I want to, in the way that I know they deserve to be supported on their health and healing
Yeah.
journey.
But that's such a powerful story. And you're right, what you said right at the beginning when you said that you usually have your own health troubles, and that's what fuels your dedication and your motivation to make a change. I think most people who find themselves owning their own, owning their own business, their own practices, they have their own experiences that is driving them through it. And I know that I can totally relate to that.
Yeah.
You said that PCOS is really prevalent. We've been saying that since we started the conversation. So how prevalent are we talking here?
Yeah, so it's estimated that PCOS impacts 1 in 10 women of reproductive
That is
age,
crazy.
and possibly more.
Oh,
Some studies even estimate like 1 in 7, which is a lot of women.
that is crazy. And it's the most common hormonal disorder in women,
Mhm.
right?
Yep.
Like
Yep.
across the board, like PCOS is the most common. I didn't know that before this conversation, before because obviously when I was looking into PCOS a bit, just so I can kind of refresh my kind of knowledge on it, I was like, oh my God, I had no idea that it was the most common. It is just, it's absolutely crazy. So this conversation couldn't be more important. When it came to your journey, your hormone healing journey, as you call it, how long was your journey? Because you said that it was longer than it should have been. So are we talking years here? Like, what are we
We're talking
talking?
years. Yeah, and I
Okay.
would say it was probably 2 years where I was really struggling, and I would say 3 to even 4 years until I got to a place where I had really eliminated symptoms and also gotten my body to a place where there was a lot more resilience. And, if I, was faced with stressors or there were disruptions in life, I wouldn't have, symptoms flaring. So it was a multi-year journey for sure.
And I can't imagine how frustrated you must have been going through that. So you said first initial 2 years, you were just, you had the symptoms. And I presume during that time you're going from doctor to doctor and, they weren't solving the problem, they were masking the problem. And I
Exactly.
can't imagine the frustration at that time for you. And you're just like, what do I do? Like I have all of this education, like, and I've got all this information from the doctors, but nothing is changing. I can imagine that that must have been a really tough time for you.
It was really, really incredibly frustrating. And I remember I actually have a very vivid memory of after I had gone off the hormonal birth control and I had, gone back to my PCP and was asking for support with this, transition with, all that I had learned just via my own research and kind of what my body was experiencing. And I asked her for support and guidance with, supporting my body with this post pill kind of phase. And she essentially laughed in my face and was like, there's no such thing as, kind of post birth control symptoms. You can either stay off the birth control and continue to experience the symptoms, or you can go back on it.
Oh my
And it was horrifying. And I remember leaving that appointment in Boston. It was raining out. I was, actually crying, and I felt so defeated. Like, what am I going to do? But looking back, I could not be more grateful for having gone through what I went through. And I have just so much empathy for what women go through and the struggles that they face with trying to get the right support. And in all honesty, the experience that I had on my own health journey combined with kind of my experience in, working in our conventional system, it really changed the trajectory of my life, my health, but my life and my career. And I think it was kind of a necessary piece of the process so I could kind of show up and support, women the way that I do now.
Yeah. And it's crazy how, for example, your program about PCOS, you come from a functional medicine perspective. So rather than talking about, medication or the pills you can take, you're talking about the basics like
Hmm.
sleep, stress, do a bit of exercise, and just the
Hmm.
things that we all know to do. But we don't understand to the very core of us the actual power of it, like how powerful those things are. And people, stuck in a conventional system, as you said, it's it's the norm. It's the norm to just be taking medication, and
Mhm.
to not take medication, you're kind of the outcast. Like,
Yep.
it's kind of strange to take an alternative route, which is
Yeah.
bizarre. Like, it's crazy, especially me and
It's
you who are
so
in the functional
bizarre.
medicine space. It's like we're just like,
It's so bizarre. And, I cannot tell you how many women I've worked with over the years that have had a, PCOS diagnosis for, 10 years, maybe close to 20 years. And no one has ever talked to them about, truly how to balance your blood sugar, or, sleep and circadian
right,
rhythms, or,
right.
the stress and kind of adrenal factor PCOS. And just those fundamentals, or the basics like you're mentioning, which, certainly there's deeper layers with PCOS dynamics, but you can't bypass the fundamentals, and
Yes,
the
right.
basics that support the body and functioning optimally. And it's so incredible what a huge impact these things make.
Yeah, it's a huge impact, and I can't wait to dive into all of that. But before we go into that, the pill. I just wanted to talk a little bit about the pill, because I've had clients in the past. I have friends. Even myself, I took the pill a long time ago. But I know people who are still on it, and I only feel like, as a friend or as a family member, I only feel like I should just give a tip and just say, "Oh, are you sure you want to be on that?" But I don't want to push it onto them too hard, because like they
Yeah,
haven't asked me, like, and I don't want to be that person who's like, "Get off your pill," like, um,
totally.
but I just wanted to talk about the pill a little bit, and anybody who's listening who's on the pill, what should they know about the pill?
I think the biggest thing, and it sounds a little bit simplistic, but I think I'm I'm often surprised. I shouldn't be surprised, but I'm so often surprised by how little information women are given when they do go on the birth control pill.
Right.
And this is what I
We
refer
just
to
put
as
on
kind of
it,
like a right.
like,
It's
just go on the pill.
exactly. And I refer to this as kind of a lack of informed consent, because women don't really have an understanding of the mechanism of action often and what's happening in their body. And I think one of the biggest things I would mention is that, if you are on the combined oral contraceptive specifically, so our combination pills, which contain synthetic estrogen and progesterone, this combination of hormones shuts down the reproductive system. It essentially works on the brain, and it shuts down the production of your own hormones. So we are not cycling, we are not ovulating. And this is a really big deal for the body. And that is not to say that there is no case where, it could be helpful for an individual. And what I always like to say is that I respect every individual's autonomy to make a decision that feels best for them. And whether you are on birth control or not, there is so much that you can do to support your health with nutrition, lifestyle, supplements. However, you should absolutely have all of the information to make that informed decision. And I would say the majority of women do not. I work with many, many women who have been on the oral contraceptive for a long time and have no idea that their monthly withdrawal bleed is is not a true period. And in their mind, they think, okay, it's regulating my cycle. I'm ovulating every month. And it's mind blowing to me that women aren't given the basic information about how the pill is actually working in their body.
Right, because the combination pill shuts down FSH and LH, which basically create the egg and release the egg.
Yep.
So if the egg isn't released, which is the whole point of the cycle, then what is the bleed? What is the bleed at the end?
It's just a withdrawal bleed where
Okay.
the body's essentially kind of like sloughing off any thickening of the uterine lining that maybe occurred. And the longer women are on the oral contraceptive or other types of hormonal birth control, oftentimes they'll have less and less of that withdrawal bleed, and
Mhm.
often, no bleed at all at the end of the day. Um, but I think it's incredibly important for women to know that, and to kind of bring in the PCOS piece specifically. We do know that with the combined oral contraceptive, this can actually worsen insulin resistance and inflammation,
Right.
as evidenced by, inflammatory markers like our high sensitivity C-reactive protein. And we also know that two kind of root causes or drivers of PCOS are blood sugar and insulin issues and chronic low-grade inflammation. And
Right.
here we are using the oral contraceptive as the first line of intervention for treatment for PCOS.
Yeah. That's crazy. And I can't believe that, like you said, lack of consent. When I started taking the pill when I was a teenager, it just seemed like the next thing to do. So you just that's what you do. That's what all the girls do. All of my
Exactly
friends were
my
doing it,
experience. Yeah.
right? Like it's just the thing you do. You go to the doctor and they say, "I think it's time you go on the pill," and it's like, okay, and it's just almost like a rite of passage into womanhood. It's like, yeah, I'm on the pill now, and
Yeah.
it's become so normal. It's like the pill. Like
Yep.
just everyone just knows that term and it's just so comfortable. So
I know.
it's crazy. And how it ties into PCOS is yeah, that's really something. So let's go into PCOS then. So what is PCOS? So it stands for polycystic ovary syndrome. So what is it?
Yeah, great question. So, PCOS or polycystic ovarian syndrome it's a complex hormone and metabolic condition or disorder. And I always like to point out that PCOS is not a disease. It's really a syndrome. And what that means is it's kind of a collection or constellation of different symptoms that can manifest differently in each individual. And PCOS is most commonly talked about as a fertility disorder or a reproductive disorder because it can commonly impact the frequency of ovulation, and women can experience, absent or irregular cycles often. But PCOS is not just a fertility disorder, and it really impacts the body systemically, from the immune system to the brain, the skin, the gut, cardiovascular health, and it's those things I think often get overlooked in conversation as well. And when I'm working with women and talking about some of the symptoms that they're experiencing and saying, oh, yep, this definitely, makes sense and is kind of tied to some of our PCOS drivers, women are often shocked because, again, they're not informed that it's not just about fertility.
Right. So if someone was at home and they're thinking, okay, I have some symptoms that I'm kind of curious about, what sort of symptoms should they be looking out for? And do you need to have all of the symptoms or just some to kind of, know that you have
Yeah.
it?
Great question. And so there's some controversy around the diagnostic criteria for PCOS. Right now, the most widely accepted criteria for diagnosing PCOS is the Rotterdam criteria, which essentially states that you must have two of the following three in order to achieve a PCOS diagnosis. One being absent or irregular cycles, which is tough to identify if you are already on the
Right.
hormonal birth
Right.
control pill,
Yeah.
right? But absent or irregular cycles, high androgens, confirmed clinically and chemically, meaning by symptoms and through blood work. Androgens, for anyone that doesn't know, androgens are a category of hormones that both men and women have, but they're often considered male hormones, since androgens include hormones like testosterone, DHEA, DHEAS, androstenedione. So women with PCOS often have elevated levels of these hormones, which can drive androgenic symptoms like cystic acne, particularly along the jawline, hirsutism or unwanted hair growth, which can be various places in the body, but women will often experience it, on their face, on their chest, and then also male pattern baldness or head hair loss is a classic androgenic symptom. And then the third criteria being polycystic appearing ovaries, and this is where things get really kind of
This
fun
is
fun and
tricky for
confusing. Yeah,
polycystic.
right.
Yes. Go into
Yeah, so
it.
it's so and basically, despite the name polycystic ovarian syndrome, women with PCOS don't actually have true cysts on their ovaries. They're actually small, immature follicles, large numbers of small, immature follicles that appear, they often look like a string of pearls, as they're referred to, or they appear cyst-like on an ultrasound, but they are not actually cysts. So it's large numbers of small immature follicles. So 2 out of 3 is how you kind of meet the diagnostic criteria for PCOS. But I'll be honest, it can be hard to get that diagnosis. I think if, that criteria speaks to you and you're like, oh my gosh, check, check, check. That sounds like me. Let's investigate and kind of push to see what's going on there. But at the end of the day, because PCOS is such a dynamic condition and it manifests so differently, and it's really about these kind of imbalances in the body, ultimately determining what's going on in your body specifically, whether it's a PCOS diagnosis, you have that label or not, is most important.
Right. So if someone doesn't quite match those 3 first criteria and they're like, but I still have problems, there are still symptoms, other symptoms outside of that they could be looking at. That could be an indication of the PCOS.
Yeah.
Yeah.
Yeah. So some classic symptoms. So the androgenic symptoms I mentioned are definitely classic. And I do want to say you can have issues with high androgens that, and not have PCOS, right? That's not just specific to PCOS, but those are some common, kind of symptoms women will experience, like the cystic acne, head hair loss, unwanted hair growth. Also, weight gain, often kind of acute rapid shifts with weight or issues with weight loss resistance, predominantly due to insulin resistance or blood sugar issues and that low grade inflammation. That's another one. A lot of fatigue, mood issues, sleep disruption, and then the, kind of irregularities with cycles. Those would be the big ones.
Right. Before this conversation, I thought it'd be interesting to have a look at a couple of websites about the medications that are given to women who are on PCOS and who have PCOS. And it's crazy. So I'm just going to list them for the listeners, because I'm sure you know about these. So like you said, the first line of defense, the pill. So that's just to kind of help with the irregular cycles. Then metformin to manage blood sugar. Statins to possibly lower cholesterol, and obviously to manage acne and hair issues, just creams, which I can imagine contain antibiotics. So that's quite a cocktail given to women.
Yeah. Yep. And I would say, I would also add to that list spironolactone,
What
which
is that? That sounds very complex.
It's a blood pressure medication that's actually kind of used off label for high androgens, and women are actually often given spironolactone outside of PCOS just for issues with cystic acne. But in PCOS in particular, when women have a lot of those androgenic symptoms, they're prescribed spironolactone, which is going to, block certain types of androgens that can drive these symptoms. And it was so common for me when I worked in our conventional healthcare system, and it's common for me in practice now for women to come to me on the birth control, the metformin, the spironolactone, at the very least often. And, sometimes, more than that. And my biggest problem, like I've mentioned, is 1, the lack of informed consent, but 2, the fact that these medications are a big fat Band-Aid at the end of the day, and they are really suppressing symptoms. But what happens when we don't want to be on these medications forever?
Yeah.
And, these underlying factors or dynamics that are driving symptoms in the first place have not been addressed. Usually these symptoms then come back with vengeance, but we also have to remember that, these medications also don't come without side effects. And again, we, respect every individual's autonomy to make a decision about medications that feel best for them. But using like metformin as an example, because this one like really makes my blood boil.
Go for it.
With metformin, there, in terms of side effects, significant, B12 deficiency, and other nutrient deficiencies, and then also significant implications for the gut. A lot of women experience really gnarly digestive issues and digestive symptoms on metformin. And alongside that, we also have a really large body of data on a supplement called inositols. Inositols kind of being I like to describe them as like the cousin of the B vitamin. And these inositols are natural. They're found in, various foods, but women with PCOS have been found to be very deficient in these inositols. these inositols are involved with insulin signaling and that, kind of insulin sensitivity and blood sugar balance. We have several, large clinical trials that have compared the effectiveness of metformin to inositols that have found that inositols are as effective as metformin at improving insulin resistance and also promoting cycle regularity without the side effects that metformin has. However, have I ever worked with an individual that's come to me from a conventional provider that has said, "Oh, my, doctor recommended I check out, this inositol supplement"? No. And that just blows my mind because I understand when it comes to nutrition research and nutraceuticals, there are things that don't have, as much data. And, from a conventional provider, sort of perspective, I can understand, how their guidelines are created and, how they practice. But when we have all of this data on certain, supplements that can be as effective without the implications of some of these medications, why wouldn't that be the first line of intervention?
And so why do you think it's not the first line of intervention?
Oh gosh, I
Just
could go
okay,
down a
that's another
rabbit hole on that
podcast.
one.
Okay.
Yeah, yeah. It's frustrating. It's
Yeah,
frustrating.
I see what you mean. I know what line you're going down there. Yeah.
Yeah.
Is it possible to heal from PCOS completely?
Yeah. So I love that question. And I do not take this statement lightly, but yes, absolutely, it is possible. And I see in practice day in and day out that it is very, very possible for women to essentially put their PCOS in remission, as I refer to it, or to significantly, significantly improve symptoms. And ideally, we want to get women to a place where they are living their life and showing up in life without debilitating symptoms and being able to not think about PCOS and have that in the back of their mind. That is the goal, and that is very possible.
Right. So when it comes to developing PCOS over a period of time, what would you say are the common triggers for it? What causes PCOS?
Yeah, so there's still a lot that is under investigation here, in all honesty, and we do know that genetics may play a really big role with the development of PCOS. Even the fetal exposure to high androgens. So if a mom is pregnant and she has high androgens, the exposure to high androgens during that time can play a role. So there is a heavy genetic component. However, we know that there are a few kind of core drivers or root causes, as I, kind of refer to them in PCOS in terms of the dynamics that really kind of create these symptoms and drive the progression of these symptoms. So those things being, insulin resistance and blood sugar issues, chronic low grade inflammation, gut imbalances. So we know women with PCOS tend to have more dysbiosis generally, or imbalances with, good to bad bacteria, more intestinal permeability. And then lastly, adrenal and cortisol issues. So what a lot of women don't know is that the adrenal glands, the little glands that sit on top of our kidneys and regulate stress hormones like cortisol, they also produce a large proportion of androgen hormones. And, those are not just produced by the ovaries. So when there's imbalances, kind of with cortisol, with the stress response system, there's lots of, stress assaulting the body that can be a big driver as well.
Right. So a high stress lifestyle, lots of exercise, lots of stress at work, stress at home, not being able to relax, those sorts of things can be drivers for PCOS.
Yeah.
So what, this is just a little question I have. What about caffeine? So linking to the adrenals, what are your
Mhm.
thoughts on caffeine?
Yeah, so with caffeine, it's kind of one of those it depends situations, and usually in practice, I'm doing hormone testing with women and testing cortisol specifically. And if I identify that an individual has a lot of cortisol adrenal issues, meaning their cortisol production and their adrenal androgen hormones are off the charts,
Hmm.
we may have a conversation about, modifying caffeine intake and just, stimulants in general. I will say though that, for the most part in my work with women, we're really able to kind of, keep some of these things in that women love if we can do it in a thoughtful way.
Yeah.
Meaning, are we waking up in the morning and, downing a bunch of coffee first thing on an empty stomach where we're jacking up the cortisol, we're disrupting the blood sugar, or, are we having, 5 cups of coffee a day? And, so maybe there's some modifications there. And I'm always an advocate of making sure we're fueling with food first and foremost. And we have that buffer in the body if we're bringing in any stimulants. But ultimately, everyone's different in terms of how they respond to caffeine, what's going on in their life, how they metabolize
Yeah.
caffeine. So it's definitely an it depends kind of answer with coffee. But as a coffee lover myself, I always like to keep things in that clients
Yes.
love. And
Yeah.
usually we're able to do that effectively with working on, the other big rocks.
Yeah. Can I just drop in a personal story with caffeine for myself? Because this is quite useful for people, because what I find is what used to work for you before doesn't necessarily continue to work for you now and into the future. So this is the biggest lesson I've learned, and caffeine is the lesson. So I grew up drinking lots of tea, like English breakfast tea. And then I think probably about 6 years ago, I got onto coffee and I was like, oh yeah. And I was just really getting into it, just having it every morning. I was like, oh, this is amazing. Like, I love coffee. Like, I'm such a coffee lover. But then literally after I had my kids, my youngest is 1. Literally, I can't take caffeine anymore. It literally, I crash so badly. Like, I can't keep my eyes open in the afternoon. And I have to go to bed early. And I didn't know it was caffeine. So for a long time, I was like, what is going on with me? Like, I couldn't work out what it was. But then the moment I stopped caffeine, suddenly, like, I'm bright again. And I'm like, gosh, I can't believe that switch happened. And even just
Yeah.
having a cup of tea, that will send me on this roller coaster. And I just can't believe how one thing can work and then it doesn't work. And that's
Yeah.
what people need to know, right?
100%. I so appreciate that story because I think so many of us can relate to that, where if something worked for you for a long time, it's hard to identify
Yeah.
that could be a problem or a
And
piece
also,
of
and if
the
someone like
problem. Yeah.
yourself was saying to one of your clients, oh, this is probably the problem, you probably need to cut it out for a bit to see how it works for you. They'll be like, well, I've been doing that my whole life though. Like, it's never caused a problem. But
Yeah.
things
Yeah.
change, right?
Absolutely. And I think you bring up important point too around kind of zooming out and paying attention to how you feel as a whole. Maybe you have the cup of coffee in the morning and you feel okay, but if you're crashing every day, you're getting that 3 p.m. slump, you're, really lethargic later in the day, we may need to kind of look at what's happening the first part of the day to
Yeah.
kind of identify what's going on.
Yeah, that's right. So, you were talking about the triggers for PCOS. So I can imagine that the changes that someone needs to make in order to begin the healing process is kind of along the same lines. So, what would you say the top lifestyle changes people should be making? So, if they're at home, like, right, I've got PCOS, what do I do? Like, how can I
Yeah.
make a natural change? What would you recommend?
Yeah, and my recommendation is typically nutrition. So
Yeah,
nutrition is in my mind always the best place to start, and really just building a supportive foundation with your nutrition that promotes true blood sugar balance. And I always say that balancing blood sugar is kind of step number one when it comes to supporting your hormones, supporting digestion. If blood sugar is all over the place, it's going to be very challenging for anything else to really have a huge impact or to stick. And on a very basic level, nailing your meal timing or meal frequency. I'm a big advocate of aligning your pattern of eating with your circadian rhythm. Obviously, everyone's different, but in terms of newer data that we have, in terms of women of reproductive age, PCOS, thinking about ironing out that really supportive pattern of eating. And aiming to have, 3 solid, well-rounded meals daily with adequate protein, fiber-rich carbohydrates, lots of, colorful non-starchy veggies, healthy fats. Sounds basic, but most of us are not doing that, or maybe, we're doing some of that, but we need to kind of make a few adjustments. I
Mhm.
would say that's my first kind of recommendation in terms of where to start. So let's balance our blood sugar with the basics. Um, I think from there, the other kind of big rocks I would think about would be, sleep and circadian rhythms. That, kind of sleep schedule, is a really big deal. And then the nervous system. So, creating protecting outlets for your nervous system in your day. Many of us are just kind of operating in that chronic fight or flight,
Mhm.
which is going to make it very challenging, to heal. And then the other one being really creating a supportive movement routine. And this is a PSA to all women out there, and I went through this challenge myself, so I can relate, but more and harder is not always better. And it's honestly usually
I've
not
done that
not
too.
better.
Yeah.
Yeah, yeah. So, focusing on more supportive metabolic movement, like walking, really like getting in those steps, strength training, cortisol friendly movement, and maybe thinking about some modifications there.
So what are your thoughts about HIIT training, CrossFit? Because a lot of women like to go into the gym and they like to smash it. So
I know,
what are
I
your
know.
thoughts on that? Would you advise them against it completely, or would you say, look, just reduce the frequency?
Yeah, so I'm more in the camp of, okay, how can we modify and still get you to be able to do the things that you love, but within a context that is actually going to be health promoting.
Mhm.
Um, for some women, it really does mean we need to cut those out for a time.
Right.
For other women, it may mean, okay, let's, kind of do less days of that real high intensity movement, or maybe let's cut down on the duration. So if it's higher intensity, we're doing shorter bouts of movement. But I think it's a big mindset shift to, think about peeling back on workouts, because, when we sweat and we get all these endorphins and like feel good chemicals, it's like, man, I got to be doing a good
Yeah,
thing
something's
here.
got to be going right.
Yeah, but we have to remember that, workouts, especially, these higher intensity workouts, these are considered traumatic stressors, right? They
Mhm.
are stressors on the body, and stress can be healthy and adaptive in the right context. But
Mhm.
in the context of the imbalanced blood sugar, the poor sleep, the high stress life, the imbalanced hormones, it's like throwing gasoline on the fire. And
Right.
that's where, it is not uncommon for me to work with an individual that is doing the high intensity training, 5 days a week. They're, doing all the things with their diet, and their symptoms are getting worse. They're
Yeah.
gaining weight. Their periods are getting more irregular. So,
Yeah, that's right. Well, that makes total sense. So, when it comes to the types of foods, you've already mentioned protein. I know
mhm.
that just looking through, just scrolling through what you do, you focus on protein. And so, do you have any recommendations for how much women should be having, or do you just think, yeah, just include it every day? That's the most important thing.
Yeah. So, and I'm curious if you find this as well, but I would say most women I work with are not eating enough protein
Right. True.
across
Yeah.
the board. Yeah. So,
Totally.
in terms of the nitty gritty, if someone wanted to kind of, calculate, generally, I'll recommend like 0.75 grams to 1 gram of protein per pound body weight as sort of
Mhm.
like a benchmark. What I find in general, though, is that if most adult women can get their protein intake at, around or a little above 100 grams daily,
Right.
we're in a pretty good spot. So maybe aiming for 30-35 grams protein per meal.
Mhm.
Usually that makes a huge difference with how women feel, and a really big difference with blood sugar stability.
I mean, what's really great these days is protein for women is really coming to the forefront recently. You've probably seen it
Mhm.
as well. Like it's quite a big noise at the moment. So I think women are coming around to the idea more. They're just like, okay, I need to get more protein into my diet. And I like the range that you mentioned as well, because I think some people say 1 gram per pound of body weight. And it's like, yeah, okay, fine. But for a lot of women, that might be, that might be a bit of a stretch because it's quite a lot.
Absolutely.
Yeah.
Yeah. Yeah.
Even I would kind of
Absolutely.
struggle with that. Um, but it's great that women are kind of coming around to that. I'm like, yes, I need to be getting enough protein in my diet. Are there any particular foods that you think are best to include within the diet? Just any particulars?
I think just generally emphasizing a more whole foods diet. So,
Hmm.
foods that are minimally processed ideally. I think, from a protein perspective, our good quality bioavailable animal proteins definitely, produce a big benefit. Um, and then I think in terms of getting zoomed in on specific foods and PCOS, um, anti-inflammatories in general, foods that really pack an anti-inflammatory punch. So
Hmm.
things like broccoli sprouts, cruciferous vegetables, things like your herbs and spices, your fermented foods, your fatty fish,
Hmm.
all can really have a wonderful benefit on various aspects of PCOS. And one thing I think I would mention too, which is not like a specific food, but we live in a very carb phobic society.
Hmm.
And because women with PCOS, over 75% of women with PCOS experience some degree of insulin resistance, they're often automatically told, or maybe they read about, going low carb.
Hmm.
And it's important to know that cutting out carbohydrates or going too low carb, even if you have insulin resistance, is going to be very problematic for the body. That is what is going to jack up our stress hormones and make
Hmm.
these PCOS dynamics worse. So instead of eliminate this, eliminate that, eliminate this, how can we provide the body with more nourishment, more stability?
Right.
Can we choose more of our kind of slow burning, fiber rich, kind of deep nutrition starches, like our
Mm.
starchy vegetables, our, fruits, our legumes? Um, so I think just in general, taking more of an addition nutrition approach
That's right. Yeah.
is kind of where my emphasis would be. Um, and I'm sure you see this too with just so many women are eliminating every food out there, right?
Yeah.
And
Yeah.
we're kind of missing the point, and we really need to
Yeah.
provide the body with a lot of nourishment.
Yeah. So when it comes to insulin resistance, let's kind of focus on that a little bit because I've got a couple more questions after this, but just literally they're small ones. So if we can just go into insulin resistance a bit more. So you said going low carb, you'd prefer to not go low carb. You'd prefer to just reduce the kind of GI of that, reduce the how fast the blood sugars are released into the
Hmm.
bloodstream. So choosing kind of whole grains and things like that. Um, when it comes to fasting, what are your opinions on that? Because I know that you said earlier that you prefer to have women to have, a breakfast first thing in the day. What about in the evening time, like stopping meals fairly early just to kind of increase the fasting window? What are your thoughts on intermittent fasting?
Yeah. So in terms of intermittent fasting in general for women of reproductive age, so I think a lot of people are applying intermittent fasting as skipping breakfast, right?
Right. Yeah.
And that really kind of works against our physiology and particularly as women. So I'm very much an advocate of, breaking your fast within the first, 1 to 2 hours of waking, having, consistent meals every 4 or so hours after that throughout the day. And then maybe shutting down the kitchen a little bit earlier and
Yeah.
having, a few hours to digest before bed.
Yeah.
I think having like at least 2 hours, maybe 3 hours, would be a good, kind of
Mhm.
target starting out so that we have, time to finish digesting before bed. And then we're going to
Mhm.
get, deeper, better quality sleep as well. For women of reproductive age across the board, though, I don't recommend really prolonged fasts in terms of
Yeah.
fasting for like more than 12 hours. And I will say too, if an individual with PCOS has more of that adrenal factor PCOS, meaning there is a lot of cortisol dysregulation and stress, we may, we may need to modify even that schedule that I outlined until the body gets to a place where things are balanced and it's
Yeah.
feeling more safe. But I definitely am an advocate of having a few hours to digest, before bed. And in PCOS specifically, I don't know if you came across this study, but there was a study done a few years ago that had two different groups of women that ate the same exact diet for 3 months
Mhm.
in terms of being matched for calories, carbs, protein, fat, fiber, all the things. But one group was a big breakfast group where they had a large breakfast. I think it was like I forget the exact amount of calories. So don't quote me on this, but it was like, 800 something calorie breakfast, which is pretty large. but very protein dense.
Mm.
So a big breakfast group. And then the other group was a small breakfast group, and they had like 150 calorie breakfast, or something that would be equivalent to like a bar, something
Mm.
that someone grabs and goes out the door in the morning. And then the big breakfast group had the small dinner. And the small breakfast group had a big, dinner. So they ate the majority of their food in the evening, but everything was the same outside of the timing of when they were eating, the bulk of their kind of calories for that day. And after 3 months, the big breakfast group saw significant reductions in fasting insulin, fasting glucose, improvements with their A1C, significant improvements with their free testosterone levels, and like a 50% or over 50% improvement in ovulation rates in just 3
Mhm.
months. And the small breakfast group that ate the big dinner saw no changes in any of their parameters in 3
Wow.
months, which I
Yeah,
think is pretty cool.
that is really cool. And I've definitely seen how having a big breakfast and then getting smaller towards dinner time. I have to say, I'm learning in this space because I was a person who used to do it the other way around. So
Mhm.
have a small breakfast and then usually have a large dinner. But I have to say, I'm starting to see the value now in stopping dinner a little bit earlier than I usually would have, and just keeping it small towards the end of the day so that
Mhm.
I can then have a better sleep, because sleep is my priority at the moment. I have 2 kids, and so I just want to get the best sleep that I can. So that's what kind of made me bring dinner a bit further forwards, so that
Mhm.
my overnight, like the amount of time I take overnight to not eat, is, that it starts from there rather than starting from skipping breakfast in the morning.
Yep.
And I'm definitely kind of evolving in that space because I have a fasting program. And one of the main things I say to the women is, if you're stressed out, if you've got lots of things going on, like, it don't follow this program to an absolute T if
Yep.
your life doesn't allow for it.
And I think it's tough because women are so underrepresented in research
Mm,
that, a lot of the studies we do have on fasting are done in men and in animal models.
right.
And we are now learning that we cannot apply that right directly to women, and our hormones and our hormone cycles are so different. But there's even been some studies done in women specifically that have found that women that skip breakfast or skimp on breakfast produce significantly higher amounts of cortisol, stress
Mm,
hormones midday, um, and have worse blood sugar parameters, than people again that have breakfast daily. And it sounds like such a simple thing, but it makes sense when you think about our biology and circadian rhythms, and that we're most insulin sensitive at certain times of day. Our
yeah.
bodies are like prepped and primed for fuel in the morning. If we're not giving our body fuel or food, it's going to
Mhm,
find glucose somewhere, and that's probably going to come from the body pumping out stress hormones and tapping into glucose stores. And
mhm.
what we don't want is to just be kind of jacking up those stress hormones.
Yeah, yeah. So, do you have any recommendations on specific supplements?
Yeah, so supplements are definitely, super personal. And I always recommend that, people kind of check with their provider and get a sense of, what's going to make the most sense for them. And particularly with PCOS, since it can look so differently in each individual, definitely recommend, getting testing done and kind of that kind of custom recommendations from your provider. But I would say across the board, some things that many women with PCOS can find, helpful. I guess my top supplements would be magnesium,
Mm,
which most people just in general can benefit
yeah.
from. So magnesium being a really important mineral. Women with PCOS have been found to be like 11 times more deficient in magnesium than individuals without PCOS. Um, Other supplements, so I really like the inositols that I mentioned. So
Yep, yep.
inositols can be really, really great. Berbeриne's another great supplement. I often use cod liver oil or like a high
Mhm.
quality fish oil for supporting, lowering inflammation and our omega 3 fatty acids. I would say those are some of the top kind of general ones that many women could benefit from exploring.
And it's generally considered safe for most people.
Yeah.
Yeah. Okay. So when it comes to yourself, then, when it comes to your business, your programs, obviously you're on a mission to help women solve their issues with PCOS and to help kind of enlighten them and show them the way. What are your hopes for the future when it comes to yourself, but then also when it comes to how women are dealt with when it comes to PCOS?
Yeah. So, in terms of my, kind of mission and the mission of the business, I really just continue to hope to empower women, to really help women get back in the driver's seat of their health, and to, eliminate physical symptoms, but also to have a healthy, flexible relationship with food and with their body, which is so crucial. And ultimately, I really hope to contribute to changing the landscape of, healthcare for women in our current system. Since, as we've talked about, women are just not supported in the way that they should be. So that's my hope. We have lots of kind of exciting things planned in terms of, affordable options, more affordable options that, women can access kind of our tools and strategies. So hoping to kind of continue to support and impact the masses and really help women change course on their journey.
And what sort of tests do you think women should be having for the PCOS? Because you mentioned affordable. Are you talking about hormone testing? Because I know that can be pricey.
So in terms of affordable, so we have, and that was kind of, referencing the sort of the, programs and things that we offer with, self-study programs and things like that. In terms of hormone tests, hormone testing or just testing in general, there is a lot that you can get done in our, conventional healthcare system. And it's about asking for the right labs and also, interpreting them within optimal, reference ranges versus our conventional ranges, which can be pretty large, but definitely at least kind of like a full blood sugar panel with a fasting insulin, a full thyroid panel, a full hormone workup, getting our lipids done, getting, key micronutrients done, would be a great starting point. In practice, I really like to run Dutch hormone testing with clients, GI map stool testing, more comprehensive micronutrient testing, which is definitely a bigger expense. However, it's a tool. And I think for some people, it's an incredibly valuable tool. For other people, I think there is so much that they can do and get started with, that may actually negate the need for some of that deeper testing in terms of working through all those fundamentals, giving their body time. But the deeper kind of advanced functional tests are there as an option, should an individual kind of get to that point and they need that deeper investigative work.
Cool. All right. Is there anything else that you want to cover that we haven't already covered? I mean, that was a pretty full conversation.
A lot. I know. We're like, I feel like we could go forever. No, I feel like we really covered it. And I think, I just, appreciate your perspective on all of this. And, I just hope for anyone out there that has PCOS that's listening that, they find this conversation hopeful and, they know that there's more out there and they see kind of the possibility to heal.
Because you have the PCOS root reversal program. Is that that's for international? That's for anybody around the globe? Is it online?
Yes.
Or
Yes. Yeah. So we have myself and a practitioner that works in my business, Courtney. We see clients one-on-one, but just in the US. But we have the PCOS root reversal program, which is a group program offered. Anyone anywhere can take it. We actually have someone from London in the round currently. Yeah.
I don't know why that's funny. It's just
normally I wouldn't have a connection like that. And then we also have a self-paced self-study nutrition course for women with PCOS, and some various other kind of resources that people could find on my website. But a few different ways that people can work with us, especially if they're not in the US.
Lovely. And what's the best way people can find you?
Yeah, so you can find me on my website, which is just jilliangreaves.com. And you can also find me over on Instagram, where I'm pretty active over there.
Yeah,
And my handle is just Jillian Greaves RD.
lovely. Well, thank you so much, Dylan. This was a really great conversation. I feel like we covered so much with PCOS, and I feel like anybody who has any questions about it, like questions are answered. So thank
Oh,
you so much
good.
for joining me. It was such a pleasure.
Thank you. It was my pleasure. I appreciate it.